Imagine what it must be like to accept the idea that life will soon be coming to an end. And then suddenly you step outside and realize there is a future after all. Born with congenital heart disease, Jeni Simonitis got a new heart when she was just 8 years old. The surgery was performed at the MCV transplant unit. The expectation was that her heart would last about 12 to 15 years. It lasted 25.
Tried to be as healthy as possible, attempted to be as active as possible. And 15 years was just a big milestone. It was just a celebration year. You know, it's kind of a landmark. But it didn't really cross my mind that I would get another organ.
When Jeni's transplanted heart began to fail, she once again began to accept the inevitable. Her healthcare team did not. That team includes nurse practitioner Maureen Flattery. Maureen cared for Jeni after her first transplant 25 years ago. Ever since then, Maureen has been there for Jeni, helping her extend the gift of time.
So one of the most important parts of the heart transplant evaluation and other organ evaluation is a assessment of how a patient can handle the regimen. So do you have the wherewithal? Do you have the support? Do you have the ability to be able to take the medications as they're prescribed? So her actual evaluation, to be realistic, was pretty easy compared to someone else who we wouldn't have known.
Most transplant candidates are larger men. They require larger hearts. Jeni's small frame was a perfect match for a smaller heart that quickly appeared through the UNOS network.
I think she was a little surprised to be getting the call as quickly as she did, and that was my reaction as well, like, really?
She is absolutely a guardian angel, and she gave me the phone call to let me know the morning that the heart was available. It was a skeleton week at work, and I was like, I have payroll to do. Like, we can't do this today. And she kept us calm.
The evaluation before transplant involves meetings with a social worker, a psychologist, a pharmacist to help educate and understand the patient's understanding of their medications. This is all in addition to the physician and the surgeon. And it's the input of all of these people that help us decide on who will be a good transplant candidate and who may need a little help to succeed after transplant.
A perpetual ambition of the Pauley Heart Center is to become an innovative, comprehensive heart failure treatment center with an array of methods and technology to care for patients whose hearts are failing. All this history, all this research, all this high-level training resulted in Jeni waking up last December and knowing immediately her future was now another blank canvas.
One of the nurses actually gave me a stethoscope, and she was so sweet, and she was like, I know this is silly, but I'm going to bring you a stethoscope so you can listen to it. And I was actually a little bit nervous doing it. So I waited because it was a weird experience to be in. It was hard to wrap my mind around. So I kind of waited for Jason to get off work, and he came, and we were able to listen to the new heartbeat together.
Jeni is also acutely aware that someone she never met made a heartfelt decision that turned into her second gift of life.
Because there's still people waiting for their first heart, and why do I deserve two? So there's a lot of guilt. And if this heart was a perfect match for somebody else, it would have gone to somebody else. So it was a perfect match for me, and yeah, I think about them every day because something tragic had to happen to them for this to happen to me.
Her story and the stories of thousands of heart transplant patients over the next 25 years will be made possible by magnanimous efforts of a great many fans of VCU, VCU Health, and the Pauley Heart Center.
I kind of feel like I won the lottery a little bit. I really can't express how thankful I am, but for me to be able to do that also at MCV and VCU Health, I mean, I really wouldn't have gone anywhere else.